Howdy again, everybody. This is Doc with ThoroFan, and just about 20 days out now from the Breeders' Cup World Thoroughbred Championships happening out in California, and we got some very devastating news out from California the end of this week that Echo Zulu, trained by Steve Asmussen, one of the fastest fillies we've probably seen in quite some time, and certainly a favorite for the sprint races, suffered a very, very severe fracture injury to her left fetlock or ankle, and is now scheduled to be undergoing what we call arthrodesis surgery in the hopes of being able to save her life, basically. So there's been a lot of questions about exactly what type of fracture she had, what happened, and what kind of surgery is going to be performed. So I figured I would come on quick and just try to explain a little bit of that as best as I can. Now, unfortunately, where I live now, I'm not near my equine leg models that I can sometimes usually use to show this stuff. And if there are any model companies out there that want to help ThoroFan out and maybe send me an equine leg model or two, certainly comment and let us know, and we would be happy to accept them for educational purposes here at ThoroFan. But back to what happened with Echo Zulu. She suffered what's known as a biaxial sesamoid fracture of her left front fetlock. And before I go any further, I do just want to kind of explain that I have no knowledge of the exact x-rays or radiographs that were taken. I have no access to her medical records. I'm going just off of kind of what has been stated in the media reports and what has been stated by Asmussen himself. So just to make that clear, any pictures that I show you or radiographs that I show you, they're just kind of general radiographs of the type of injury she had. They're not her specific radiographs. So getting back to exactly what happened. The equine limb, and especially the lower limb when we're talking about the fetlock or the ankle joint, is very complicated, and it's all involved in a very delicate, what we call suspensory apparatus. And at the end of this video, you will see a link to another video that I did for ThoroFan and education about the term breakdown, and it goes into a lot more detail of the anatomy and what's involved. But for the purposes of this, we're just going to talk about what are known as the sesamoid bones, and these are two bones that sit kind of at the back of the fetlock area. And they really kind of serve as an area where that suspensory ligament and some other ligaments and tendons kind of wrap around, and they kind of help support the whole ankle and that fetlock in the right position and provide help with a little bit of the bounce back when it meets the force of hitting the ground. And you can see exactly a little bit in the anatomy diagrams that are popping up here, and how important it really is to the whole suspensory apparatus that is the fetlock. And so, as I said, there's two. There's one on the inside and one on the outside of the fetlock joint. And in her case, what happened with Echo Zulu was both of those sesamoids were fractured. How severely? Again, I don't have the radiographs. I don't know. But this is a picture of a radiograph that was taken from a paper written by Dr. Larry Bramlage, who a lot of people know. He basically pioneered the type of surgery, the arthrodesis surgery in horses, that is going to be used to hopefully save her life, and we'll talk about that in a minute. But as you can see, as we showed the normal originally, when you look at the abnormal, as you can see here, you can see certainly that the sesamoids are quite fractured and everything is kind of pulled apart and distracted. And of course, when you don't have that support, that backward or kind of behind the fetlock support for all of those ligaments and things, everything just kind of sinks down, and there's no support left to the leg. Now, in her case, because both sesamoids were fractured, there's a chance that some of the suspensory ligaments and other tissue in there was probably damaged. Again, I don't know for sure, but that is a lot of times what happens when you get these biaxial fractures. So what they immediately did is, as you heard, is what's called a Kinsey splint. They put that on her, and what that does is basically take the pressure off and act as a temporary stabilization for the fetlock. So this way she can bear weight on the leg and move around, without doing any further damage to that ankle. It looks like it's been determined that the blood supply to the area is still okay. Otherwise, they really wouldn't be talking about surgery at this point. They probably, unfortunately, would have conducted euthanasia already if they felt that there was no way that valid blood supply was there going through the fetlock and down into the hoof and back and all of that. So that's good news. It looks like it was a fracture, but they were able to kind of stabilize it before a ton of damage was really done to the joint. So that's exactly what a biaxial sesamoid fracture is. And for those wondering, we have sesamoid bones in our own body. Our fingers have tons of sesamoid bones, and they all help with, acting as kind of that kind of pulley fulcrum a little bit, or just an area where ligaments kind of, can go over and allow ligaments and tendons to stretch and move and all of that stuff. So, sesamoid bones are common throughout the body. In this case, we're just talking about the ones that are located, in the fetlock or the ankle joint. So now, what is going to happen and what surgery is going to be performed? What's going to be performed is what's known as a fetlock arthrodesis. And arthrodesis basically just means what the surgeons are going to do is they are going to fuse the joint. They are going to make it so that the joint can't move at all, but they're going to do it in a way that kind of fuses it in as close to a natural position for the fetlock as possible, and use a lot of hardware to make sure that that whole area is stabilized. And then over time, what's going to happen through a lot of work that they do in the joint and in the surgery itself, it's going to allow basically the joint, for all intents and purposes, kind of disappears as a joint. And the idea is to try to get it to fuse almost into solid bone as best as can be. Now that's a very general description. You're not going to get like a solid bone going from the cannon bone all the way down into the first phalanx there, but you do try to get as much bone growth and stabilization in the fetlock joint, because basically you don't want or need the joint to move anymore. You are doing it solely as a stability support. And as I said, this procedure was pioneered by Dr. Larry Bramlett. You can see some of the photos here of the amount of hardware between plates and screws and wires and things that are called tension bands that kind of go back behind and serve as kind of an artificial sesamoid in a way, with the way that they're anchored to provide that backward support to the fetlock to prevent it from sinking down. So that's kind of what's going to be done. It's a fairly common procedure, I would say. Not as common as some other surgeries that are done out there, but over the years, more and more surgeons are doing these surgeries. It was the surgery that was done on Barbaro to try to stabilize that area back there. Many horses that have major fetlock injuries or severe arthritis or other types of damage to the fetlock area sometimes will undergo a fetlock arthrodesis to take away the pain and constant inflammation there and just give them a better quality of life. So the hope is that she's going to go through this surgery okay and that everything will work out. A lot of people have been asking, is the surgery, will she be okay after the surgery? The answer really is you've got to wait a little bit and see. The post-operative period sometimes can be the trickiest with these surgeries. It's not the surgery itself that's the problem. It's the post-op period where a horse may be more prone to developing laminitis because of unequal pressure on the front limbs. They may put more pressure on the good limb, which potentially can lead to laminitis in that limb. You do have the risk of the potential breakdown of some of the apparatus there, where the screws don't hold exactly well, or the body starts developing a little infection around the bone plate. There's a lot of different complications that can certainly creep up and cause a lot of problems, but she's, of course, going to be getting the best care possible by the best surgeons possible, so they do watch for all of these things, and they've developed a lot of techniques to make recovery a lot easier for these horses. And hopefully she will come through surgery okay and go on to live a happy life, potentially as a broodmare, but even if she can't do that, at least enjoying her life as a mare. So hopefully that answers some of the questions that anybody may have had about what's going on with Echo Zulu, and we will, of course, follow, and if any updates are made, we certainly will try to bring them to you right here at ThoroFan. And as always, if you, the racing fan, are looking for the most up-to-date and accurate information from us, the racing fans, there's only one place you need to turn, and that's right here at ThoroFan.